Hey out there. Welcome to your next edition of Spilling the Tea with Dr. T, where we're not about gossip or slander, but we aim to share the truth, knowledge, upliftment, and to add positively to your life in some way. How are y'all doing out there? Happy Wellness Wednesday. I hope everyone is doing well. There is so much going on here in these United States, around the world, but I do hope that you're taking care of yourselves. I do hope that things are well with you. And I don't know about y'all, but it just seems like summer has flown by. Before you know it, we will be in fall. So I'm just trying to enjoy these last, few days, this few weeks of summer before we transition into a new season. Transitioning into a new season can be great, but also, any change can be a little difficult as well. And so sometimes it's hard to move to the next stage, right? But I wanted to jump on real quick and continue the series on self-care. I've been talking about self-care for quite a few posts. Still wanted to continue on the topic of physical self-care. And so on Spilling the Tea with Dr. T today, the tea is that you have to keep up with your wellness care exam. You have to keep up with your preventative wellness care exams. Some of you, or most of you, probably have heard this very wise proverb: an ounce of prevention is worth a pound of cure, right? You might have heard it from your grandparents, your parents. You might have read it in a book, seen it in a movie, seen it on TV. An ounce of prevention is worth a pound of cure. And all that simply means is that it is easier to prevent a situation from happening or prevent a disease from happening versus trying to fix it once the damage is already done. It's much easier. It's less time consuming. It's less resources that has to be used in preventing something from happening versus trying to fix it once the problem has already started. And let me tell you, that proverb, that wisdom is golden as it relates to your health care. As a primary care provider, even now working in the emergency room, I come across so many patients who have never seen a doctor, not since childhood, or hasn't seen a doctor in years. And to be fair, some of these patients are immigrants from in their countries. They don't have access to medical care. They come here, it's hard for them to get medical care. But even in cases where people are offered access or they have access to medical care through health insurance, a lot of individuals do not take advantage of getting their health exams on a regular basis to prevent disease. The whole point of preventative care is for us in the medical community to survey what is going on with your health, to look for certain things and certain red flags ahead of time so that we can prevent disease instead of waiting for disease to happen and scrambling and putting all these resources into trying to get you better. We want to keep you healthy. We want to work with you to take steps to prevent disease. And so that's the whole point of these preventative care exams. So what do I mean by preventative care exams? One is getting your annual physical. Parents are really good about making sure their kids go to their doctor's appointments, get their vaccines at 2 months age, 4 months, 6 months. But when we become adults, it's like we neglect ourselves. And you're no good to your kids or to yourself if you're not taking care of your health. So you want to be getting, starting in young adult age, getting an annual physical. Even if there's nothing wrong with you, get an annual physical, get your blood work. So again, that we're looking, we're surveying, we're screening to see if there's anything on the horizon. And if so, we can jump on it ahead of time. Some other important other important exams. I'm not going to talk about all of them. I will drop a link in the chat with some important guidelines for health maintenance. But some of the big ones that you are probably aware of: for women, getting your mammogram. Women, you have to get your mammogram as recommended by certain expert agencies. Now, let me tell you, with health guidelines, it may vary between different health committees, but for the most part, they're kind of all in sync. Depending what you read, some people say women should start to get mammograms from age 40. There are some bodies who more recently have said, you know what, 40 is a bit too young. Women can start to get mammograms from age 50. That's a discussion you should have with your doctor. I personally recommend that my patients get mammograms starting from age 40, simply because breast cancer continues to become very much more prevalent, especially in certain ethnic groups. And so I err on the caution of starting earlier, but getting that mammogram. Another huge one is colon cancer screening. Colon cancer screening. And you may not be aware, but the recommended age for colon cancer screening has dropped from age 50 to, we are now recommended that you get colon cancer screening starting from age 40. Why? Because colon cancer is on the rise in the population here in the United States. We are seeing younger and younger people, less than age 50, with colon cancer. So we've made adjustments, and now the recommendation is get your colon cancer screening starting from not age 40 actually, age 45. I don't know if I said 40, but age 45. And the best screening test for colon cancer is a colonoscopy. Y'all, I'm getting my colonoscopy in October. I'm a doctor and I know what it entails. It's not really scary, but it's not something I'm looking forward to because I've never done it before, but I'm gonna do it because I want to take control of my health. So making sure you get your colon cancer screening starting at age 45. Colonoscopy is the best test. They do have other tests such as sigmoidoscopy, what is that other thing? Cologuard, where you're checking for cancer cells in your stool. You can talk to your doctor about different ways to be tested, but the thing is, you want to be starting to do that at age 45. Men, prostate cancer screening, especially in minority groups, Black men, Latino men. Prostate cancer tends to occur in a younger age, and it tends to be more aggressive when it does happen. So you want to get your prostate cancer screening at a younger age, maybe starting age 45 versus other groups can start a little bit later. But the point is, you want to include that as part of your health screening. And then one other example, pap smears. Pap smears screen for cervical cancer in women. The recommendation is starting at age 21, you want to get pap smears yearly within 3 years of being sexually active. And once you're age 21, up until age 65, you should be having yearly pap smears. As you get older, you don't need them as much, and that's a discussion to have with your primary care doctor. So those are just some examples. You want to take advantage of health screening tests that are available. Listen to me, people. Medicine is so broad and so complex. There's so many things that the medical community does not have a handle on. For those few things where we have made some headway, where we can catch things early, such as the case of breast cancer, cervical cancer, colon cancer, managing high blood pressure, managing and screening you for diabetes, doing your eye exams to check for conditions that put you at risk for deteriorating eye conditions. You want to take advantage of those areas where we can make a difference early and get your preventative screening exams. Speaking of eye exams, I want to do a shameless plug, not shameless, intentional plug for my little sister, my play little sister. She's been adopted in our friend group, Dr. Camille Cohen, who has a fabulous eye care practice. She owns a Pearle Vision franchise in Brooklyn, New York, and she is an excellent primary care eye specialist. I trust her with my vision. I went to her yesterday to actually get some follow-up with my eye. So if you're in the New York City area, Connecticut, New Jersey, I recommend you check her out. She is excellent in her knowledge and in her bedside manner. She makes you feel right at home, and I will drop her information. And so just a really quick tip to help you keep up with your health screening. What I typically do is I pick a month where I try to get everything done as far as my health screening. So August going in September is going to be my health screening, month where I do everything. I'm going to get my mammogram done. I'm trying to schedule my pap smear. I had my eye exam yesterday. As I said, I'm going to be doing my colonoscopy sometime around the next month. So maybe pick a time of year, a particular month, where you can just line everything up and get it done. And the reason why you also want to know about health screening and advocate for yourself is that doctors are human beings. Sometimes things fall between the cracks. So you want to know what you should be doing when, so that you're collaborating with your doctor for your health and for disease prevention. So that's it. Spilling the tea with Dr. T. An ounce of prevention is worth a pound of cure. You have got to keep up with your preventative health screening tests and exams. Hope you guys have a blessed Wednesday and remainder of your week. Remember, make it a great day. Self-care is life care. Until next time, love you and God bless.